Payers are increasingly using and implementing clinical pathways in any type of malignancy, hematologic malignancy and solid tumors, in paying for these expensive agents. I would say that it is, at least my observation, is that hematologic malignancies are a little bit lagging behind in terms of the, I would say, uptake by payers, and part of this is the diseases themselves. I mean, I think, it's very difficult in malignant hematology sometimes to have a very clear pathway because of the heterogeneity of disease, which is more pronounced in hematologic malignancies than in solid tumors, although it's just happening across the board now. But yes, I am seeing more of payers wanting prescribers and hospitals and healthcare systems and all physicians adhere to certain pathways. Payers, however, recognize that you cannot adhere to clinical pathways 100% of the time. There's a lot of heterogeneity between patients. There are a lot of factors that we cannot always account for. So most payers have accepted that adhering to 75 and 80% of the time to these clinical pathways is acceptable. And the 20% non-adherence is usually related to the other factors that we cannot account for. The short answer is yes, I believe payers are increasingly wanting this adherence to pathways. They want reduction in variability of care, because this not only is best practice for patients, but also it reduces the overall healthcare cost, which is something that we all have to really focus on. All stakeholders have to be involved in all the efforts that lead to reduction in healthcare costs.